Arthritis, why does it happen? You've probably Googled that or put that into YouTube trying to find out why arthritis happens. Now, we're going to talk about spinal arthritis, but it's the same process for bony and joint arthritis, so-called old age arthritis. You might also know it as osteoarthritis. Now, the principle is the exact same. Now, let's back up a little bit. There are three main different types of arthritis. There's psoriatic arthritis, there's rheumatoid arthritis, and then there's the most common one called osteoarthritis. Now, osteoarthritis used to be called old age arthritis, meaning that, or implying that, old age is what causes arthritis. That's not true. It's not age that causes arthritis. It's actually duration of time since the onset of an injury or an accident. Let me explain. So let's say, for instance, you go on a nice, beautiful summer day and you decide to go on a bicycle ride. And instead of taking your bike up a hill, you decide to go down a hill. So you go down a hill, you're having a wonderful time, and all of a sudden, a raccoon runs out, and you don't want to hit the raccoon, so into the ditch you go, and you do an endo, and you flip your bike or whatever. You have some kind of trauma. That is the start of arthritis. So what happens is the accident, injury, or trauma causes the mechanics of the spine to change. So when the mechanics of the spine change, the forces that go into the joints are different, because now you've got adhesions and fibrous scar tissue around your spine because of the accident. And literally, falling off your bicycle and taking a little tumble can create those fibrous adhesions or that scar tissue. So what happens is, it's around the joints and they don't move the same as they did previous to the accident. So the flexibility and the elasticity of the joints change. So as a result, the normal forces from the activities of daily life going into the joints differ, and what happens is the bones change shape according to the forces that are going into them. So if the forces are perfect and everything is fine and the spine is moving properly, the bones have this shape. But after the accident, the forces going into the spine and the joints are different, so the joints and the bones themselves start to change. They remodel themselves based on the forces that are going in. That starts the arthritic process. So what happens often, especially with a whiplash type of accident or an injury, instead of having the proper arc to the neck or having the proper arc to the low back, what happens is the curves start to flatten out. So the curves start to flatten out, flatten out, flatten out, and if the person's looking this way, the front parts of the joints get a lot more stress, and that mechanical stress over a long period of time causes bony growth. And guess what? Arthritis doesn't feel good. It changes the way the joints move, and guess what? The discs start to degenerate, and guess what? Also, the nerves start to get affected. The signals through the nerves to the target organ, gland, or tissue. So with bicycle accidents or skiing accidents or like big wipeouts in your driveway, hockey, gymnastics, of course, and motor vehicle accidents, what happens is the curves of the neck start to change, and then you start to get irritation to the nerves at the base of your neck, and then you get misdiagnosed as carpal tunnel syndrome. So for anybody that's had any kind of so-called minor sports injury, wiping out in the driveway, falling down the stairs, gymnastics, or any type of motor vehicle accident as little as 15 to 20 kilometers an hour, we absolutely encourage you to get your spine checked. We want to see how the curves are, we want to see how they're moving, we want to see the levels of arthritic activity and disc degeneration. It's a big deal. We at Life Lounge Chiropractic and Health Center in Burlington, Ontario are specifically trained on how to rebuild these protective arcs, to get the pressure off the vertebra, to help the body start to reabsorb some of the bad calcium and help the discs start to re-engorge and get thicker. We're pretty good at this. Just check out our Google reviews. People get great results here. We want you to come in and see us. We want you to come in and see us to investigate what's going on, so much so that our normally priced initial assessment of $197, it's been reduced down to only $50. Please consider coming in and seeing us. We can help you. My name is Dr. Brad Deacon. I'm coming from Burlington Spinal Decompression and Life Lounge Chiropractic and Health Center. Thank you.